my name is Laura. I'm a registered nurse at Asia Pacific Surgery, and today I'm going to walk you through your post-operative instructions following a mommy makeover. A mommy makeover typically combines several different surgeries, including a breast augmentation, liposuction, or abdominoplasty. These surgeries all require special care, so let's get started. For pain relief, Tylenol is safe to take. Please avoid any NSAIDs like ibuprofen or Aleve, as they may increase your risk for bleeding. If you are prescribed a narcotic pain pill, please take that as needed. You will be prescribed a nausea medication if you become nauseated after surgery, as well as a laxative or stool softener if you become constipated. Please take and complete the course of antibiotics to prevent any infection from occurring. Rest is an important part of your recovery. After your mommy makeover, it's important to rest in a position that minimizes pressure on your breasts or your abdomen. Laying with your body elevated and your knees slightly bent will help minimize pressure on the surgical areas. Sleeping with the head of bed elevated will help support your incisions. Use extra pillows under your knees for support, and avoid sleeping on your side or stomach to prevent strain on your incision lines. Movement is key to a successful recovery to help with preventing swelling and improving circulation. Make sure to walk around as soon as possible to help prevent blood clots and keep the blood circulating. Avoid heavy lifting or any bending for at least 6 to 8 weeks. It is important that you wear your compression garment 24/7 for the first 4 to 6 weeks to help with the swelling and support your body. The garment should fit tightly but not too snug where it's cutting off blood circulation. You may have JP drains in place. If you do, please refer to the JP Drain Care link below. It is important to keep your incisions clean and dry. If you have dissolvable sutures, they do not need to be removed. Make sure you monitor your incisions for any signs or symptoms of infection, like redness that spreads or drainage that is green or yellow in color. Please avoid applying any lotions or creams to your incision sites and avoid direct sunlight. You may shower 24 to 48 hours following your surgery. Please avoid soaking in any water like bathtubs, pools, or jacuzzis, or until your clinical team clears you. This clearance usually occurs around the 2 to 4 week post-op mark. Bruising and swelling are common after surgery, and it can take some time for those symptoms to resolve. Final results can take several months to appear as the swelling subsides and the body heals. It is also common to experience numbness and tingling. Please be aware that these are normal and it will resolve over time. Attending all your follow-up appointments are crucial to a safe recovery, so we can monitor your status along the way. Your follow-up appointments are typically scheduled at the 3 days, 1 week, and 1 month post-op. Recovering from a mommy makeover may take some time, so it's important to stay patient with yourself. Rest, hydrate, and eat healthy foods. Please don't hesitate to reach out if any questions or concerns come up along the way. We are here to help you every step.